Hi, I'm Dr. Hankins Sohn, a board-certified plastic surgeon in Las Vegas, Nevada. Today we'll be talking about and watching the mini facelift procedure, a 2-hour operation that is typically done while awake with a local anesthetic. As you can see with these before and after photos, it is specifically designed to address the lower 1/3 of the face and neck, smoothing and tightening the jowls and neckline, leaving you appearing more refreshed with a natural result. Please keep in mind that the information contained within this video is generic, and the procedure that is right for you needs to be tailored individually, and that can only be done with a face-to-face consultation. If you're interested in setting up a consultation, please contact us at 702-897-1330 for an appointment today.
Fabulous.
So we're here with Mary Sullivan-Bryan. We'll be doing her mini facelift today under local anesthesia, so she's going to be awake for the operation. What were your primary concerns in undergoing this operation?
Well, I think, like a lot of women feel that after 40, you start getting, into what we call a little jelly in this lower section, and, fillers can help for a while, but then after a while, maybe it just looks a little too thick, and we want more of that lifted, heart-shaped face that we had when we were closer to late 20s, early 30s. So.
The face is initially prepared with a sterilizing solution. Surgical markings are drawn out, delineating incision sites, which will begin at the sideburn, turn downward directly in front of the ear, and sometimes extend behind the ear as well. Liposuction is performed on the neck to remove any fatty tissue to improve contour and release the skin to allow it to redrape properly. The procedure involves numbing up the neck and cheeks with a series of injections. This portion of the operation may be uncomfortable, but is usually well tolerated by patients. Once the face is numb, there will not be any sensation for sharp pain, but there will be a pressure sensation while I am working. Liposuction is then performed on the neck to remove any fatty tissue to help improve contour, as well as to release the skin to allow it to redrape. The operation then proceeds with the left, followed by the right side of the face. Incisions are made in the sideburn, extending in front of the ear. A true mini facelift stops the incision slightly behind the ear. For some patients, an extended mini facelift may be necessary, where the incision behind the ear is extended upwards and back into the posterior hairline to allow for greater neck tightening. The skin of the face is then lifted, and the underlying muscle, the foundation of the skin, is exposed. The technique that we use is called a max lift, MACS, for minimal access cranial suspension, described in 2001 by a group of Belgian surgeons. This modern technique of lifting relies on the anchoring of sutures into the deep connective tissue of the temple. Permanent sutures are then run from the temple to the jaw, as well as to the corner of the mouth and sometimes to the upper cheek. These sutures permanently lift and tighten the muscular foundation, which leads to a long-lasting result. Once the muscle is tightened, then the skin is lifted, trimmed, and closed with dissolving sutures. Upon completion, the skin is then cleaned, and a noticeable change to the jowls and neckline is already visible. A bulky head wrap is left in place for 24 hours for compression and support. Patients are seen back in the office the next day, and a lighter compressive head wrap will be provided that will be worn continuously for 7 days. So we're back on the first post-operative day after Mary's mini facelift, and as you can see, she does have some soft tissue swelling, a little bit swollen from side to side, but all the incisions look very good. Everything's nice and smooth. Jawline is much more defined. Neckline is nice and tight. So for the degree of swelling that she has, this is pretty typical after one day. So how was your evening last night?
Actually, it was really pretty easy. When I first got home, I sat upright in a lazy boy and attempted to watch a movie but fell asleep. And then my good nurse escorted me off to bed with lots of pillows propped up, and I slept up. And as long as I was taking my medication every 4 hours, I was really painless.
Perfect. So you're all set, and we'll see you back in the office next week.
Okay.
Okay?
All right.
Comfy?
Comfy.